Assalamu alaikum. 8-point Compass Rose Underlay technique in 72 consecutive early patient in large incisional hernia. Summary background repair of incisional hernia IH in the elderly in a challenge of surgeon. Primary closure in preferable but is not always possible because of high recurrence rates of IH repaired without a prosthetics in the possible respiratory and cardiovascular complication due to extreme tension of margins. We report our experience with underly mesh placement in elderly patient with large IH method. A total of 72 patients from January 2003 to December 2009 underwent IH repair involving replacement of an intervention gourd doll mesh prosthesis. The prosthesis was first anchored in 8 points in the compass rose pattern using a gourd suture pacer and then firmly secured the abdominal wall with the 360 century internal ground running suture. Results 2. Intraoperative intestine tears occurred during debridement and were immediately cured. Postoperative complications included 7 seromas, 4 hematos, and 2 infection, one of which was resolved with conservation treatment while one required prosthesis removal. Conclusion: these surgical procedures like laparoscopic treatment allows of surgeon to avoid dissection of the abdominal layer and improves prosthetic adhesion with reinforcement of the incisional area near the abdominal defects. The reduction in operation time is remarkable despite good result in terms of safety and minimal recurrences for laparoscopy in the management of IH. The use of minimally invasive technique for large incisional walls defect, especially in elderly patients, is still controversial and practiced by few surgeons. This open technique avoid cardiopulmonary complication arising from in the elderly. Keywords: Introduction: the incident of incisional hernia IH is 1 in 50% and the risk of the cancer increase with the patient age. Wound infection obviously improves cure closer problems accompanying gained IH of the abdominal walls or the frequently different from the result in an elderly patient because they are often obese. They have a history of several previous operations. They suffer from multiple comorbidities. Their abdominal wall is of the poor quality and in certain cases the visceral mass is so herniated that the abdominal domain is lost. Those various factors can mean that primary repair may be difficult or even impossible. The resulting tension and lead of early recurrences and possible deterioration beyond the state of original hernia. 4.5 cardiac and complication must not be overlooked is early patients.